Hello, my name is Sinead McParland. I am a dietitian as well as nutritional advisor for the Aiken Group. So today I'm going to discuss the importance of nutrition with your ileostomy. Just before I start, I do want to highlight the fact that the advice today is very general and it is very individual to each and every person. If you have any concerns, it is important that you speak to your healthcare professional, either your stoma nurse, your GP or your dietitian. So let's get started. You've had your surgery, you've had that large bowel removed or your colon has been removed. But your colon never played a huge role in the absorption of nutrients in your body. It did, however, play a role in the absorption of fluid or liquids as well as electrolytes such as your sodium and potassium into your body. So the general dietary advice would be to get back to as normal, varied diet as possible, ensuring that you're following a well-balanced diet. And I will talk about a balanced diet later on in the video. But there are a few things I do want to focus on before we get to that. And as I discussed, your colon is no longer there, it has been removed, so you're not absorbing as much fluid or liquid as maybe you would be if you still had your colon. So we want to reduce the risk of dehydration, so we need to replace some of that fluid. And what we'd recommend is to add an extra 1.5 to 2 litres of liquid, of fluid, into our diet on top of what we're currently taking with our fluid to reduce the risk of dehydration. Now, the signs of dehydration would be things like a dry mouth, dizziness, tiredness, maybe a low urine output. If you experience any of them, it is important to speak to a healthcare professional. So I also did say that your colon absorbs your electrolytes, so your sodiums and your potassium. So you maybe have to replace the salt or the sodium, the salt into your body. And we would recommend that you would add an extra teaspoon of salt into your diet. So this can be done in cooking, it can be done at the table. Introducing salted foods into your diet, such as sausages, hams, cheese, maybe canned tuna, bacon, salted crisps or salted crackers. But it's important to highlight that in time your body will start to adapt and start to absorb more liquid and more electrolytes, and therefore you won't have to add that extra fluid or extra salt into your diet. So other considerations when it comes to your ileostomy includes fibrous foods or high fibre foods. These are difficult to digest with or without having your colon. But in your colon, there is certain bacteria that helps ferment these foods, break these high fibre foods down so they're easier for us to pass. So again, we don't have the use of that colon, so that fermentation isn't happening. But what happens is, if you're having high fibre foods, they might be difficult to pass. They maybe cause a blockage. And this is what we don't want to happen, especially in the first few weeks after surgery. We want things to heal. You want things to settle down a wee bit. You want to give that healing process a chance. So for the first 6 to 8 weeks, again, it's very individual. Some people maybe less, some people maybe more. But we recommend that you would reduce your high fibre foods for that length of time, as I said, just to help with that healing process. So certain high fibre foods that maybe could cause problems or cause blockages could be your nuts, your pith that's on your fruit, the skins on fruit and vegetables as well, mushrooms, seeds, things with pips in them, sweet corn, dry fruit. But after that period, or that healing period, we will be able to reintroduce these high fibre foods in smaller quantities as tolerated per each individual. Okay. So other areas to highlight, I suppose, after your surgery is looking at your meal pattern. Some people may need to take small, frequent meals, not able to tolerate 3 large meals in the day. So having small, frequent meals throughout the day, and maybe not having that late night meal, so then you don't have that nocturnal stool production. You won't have to get up in the middle of the night and change your bag. Again, it's very individual and it's what you can tolerate. Also, your appetite is another thing to consider. You maybe didn't have a very good appetite pre your surgery, and this just doesn't return just because you've now had your surgery. You will still maybe have a reduced appetite. So having things like a soft diet, things that are maybe a wee bit easier to digest until your appetite is triggered and it starts to come back, and you're maybe being able to tolerate a wee bit more. So as I say, if you have any concerns, it is important to speak with your stoma nurse or your dietitian, your doctor, your healthcare professional. But this is just general guidelines of what's happening in the first few weeks after you have surgery and the things that maybe you need to focus on. Okay, thank you.